Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources and tools to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you if needed. Now, I always like to give the disclaimer and reminder before getting started that we know there's no absolutes in medicine, right? We treat on a patient by patient basis, and any of the questions that you see that I have on any of my videos, they are based on the guidelines that are currently being tested on the ANCC as well as AAMP exam, in any videos that I do, and I teach on things that we are currently doing in practice, I will always say that so there's no confusion, okay? So, with that being said, let's get into question number one, you guys. Question number one for today states the nurse practitioner and NP student are discussing tetracyclines and contraindications. All of the following are contraindications of tetracyclines except: is it A, pregnancy, B, children under the age of 9 years, C, hypoglycemia, or D, a known allergy? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first because it allows you to slow down and answer what is truly being asked of you, okay? So here, the stem of the question states, all of the following are contraindications of tetracyclines except. And you pay attention to these words because also while it's allowing you to slow down, it's making you identify things like that in the stem of the question, right? Except. So we're looking for what's not correct, right? So they're talking about tetracyclines and contraindications. So what do we know knowledge wise on contraindications of our tetracyclines being like your doxycycline? Is it A, pregnancy? Yeah, that is a contraindication. The B, children under the age of 9 years. That's also a contraindication of tetracyclines because remember, one with pregnancy, you don't want to start giving it because it can cause the fetus to have long term or permanent discoloration of their teeth. Um, they can turn yellow, brown, and just permanently be discolored. Children under the age of 9 as well. And then also concern of hepatotoxicity in pregnancies as well. C, hypoglycemia. That's your answer. That's not a contraindication for tetracyclines. And D, of course, if you have a known allergy to something, it's contraindicated. You don't want them to take something they're allergic to, right? So you'll see me throwing in some farm stuff because I get a lot of questions about farm. So just to kind of help with your review and thought process on these, I'll throw some of these in, okay? All right, you guys, question number two for today. The nurse practitioner and NP student are discussing the initiation of Synthroid. They mention that Synthroid is typically initiated at 12 micrograms, but the nurse practitioner reminds the NP student that some people require a lower starting dose of 12.5 micrograms. All of the following require a lower dose of 12.5 micrograms of Synthroid initially, except the A, geriatric population, B, patients with a history of asthma, C, patients at risk for AFib, or D, patients with underlying cardiac disease. Take a moment and tell me what you got, you guys. All right, you guys. So, stemming the question states all of the following require a lower dose of 12.5 micrograms of Synthroid initially, except. So, again, we're looking for that incorrect, right? So, we know that we typically start Synthroid for patients at 25 micrograms, right? Well, there are some people who we know to start them off with a lower than that dose, 12.5 mics. So, which population do we know that we do this with? And we're looking for the one that does not fall into that category because it says except, right? So, A is a geriatric population. Yes, we actually do want to start them at 12.5 mics. When I always say with the elderly, the geriatric population, with everything, we go low and slow with them, right? They metabolize much slower. So let's start low and slow, and then you see how they respond and you navigate from there. So you do start at 12.5 with the geriatric populations. B, patients with a history of asthma. No, that's not correct. There's nothing that states that it's beneficial to start at 12.5 mics with someone who has a history of asthma. So B is your answer. C, patients at risk for AFib. Yes, we do want to start at 12.5 mics with them. And then D, patients with underlying cardiac disease. We also start at a lower dose of the 12.5 micrograms also, okay? All right, and question number 3. The patient's LDL is elevated and the nurse practitioner is looking to reduce it by 50%. Which is the best medication to prescribe to aid in the 50% reduction in LDL? Is it A, atorvastatin, 80 milligrams daily? B, simvastatin, 10 milligrams daily? C, pravastatin, 20 milligrams daily? Or D, simvastatin, 40 milligrams daily? Take a moment and tell me what you got in the comments. All right, you guys. So, similar question states, which is the best medication to prescribe to aid in the 50% reduction in LDL? All right, so the question is talking about this patient has an elevated LDL, right? Your bad cholesterol, and the nurse practitioner is wanting to reduce that by 50%. So, what medication and dose would you give to meet that goal, right? So, is it A, atorvastatin 80 milligrams daily? Yes, that's actually the answer, the best answer here. But let's go through all of them and then I'll go back and talk about A. So let me give you a background. And you probably are familiar, but sometimes people don't realize why we do this. They just know there's different statin intensity. So with statin therapy, there are high intensity, moderate intensity, and low intensity statins, right? And you're like, okay, so what's the importance of this? So statins really work on knocking down that LDL, reducing that bad cholesterol, right? So with the low intensity statins, it lowers the LDLs less than 30%. Okay. So if they're just slightly elevated, you can start with a lower one, to kind of reduce that. Moderate intensity is anywhere from 30% to 49% in reduction of that LDL, right? And then your high intensity statins reduce those LDLs by 50% or greater, okay? And so there's a chart and everything that you can look at. And if it's something you want, just let me know. I'll send it to you. But just look at the intensity chart of statins and it'll give you medicine. So it's not like something that you have to um, try to memorize all of these medicines and dosages for exams, but you do need to be familiar with um, low, moderate, and high intensity so you understand what they mean if they're asking you a question on reducing that LDL by a certain percentage. And so, for example, atorvastatin 80 milligram daily is a high intensity statin, so it's going to reduce the LDL by 50% or greater. But you can give that atorvastatin anywhere from 40 milligrams to 80 milligrams, okay? Now, simvastatin, you see I have that on here twice. Simvastatin at 10 milligrams is a low intensity statin, right? Whereas simvastatin 40 milligrams is a moderate intensity statin. So as that dosage increases, it has it works a little bit more percentage wise at reducing that LDL. So atorvastatin 80 milligrams falls into that high intensity category where there is a reduction of the LDL by 50% or greater. And since our goal is to reduce it by 50%, that's the best answer choice. So A, 80 milligrams. All right, you guys. So I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure you meet me back here. If you need any resources from the Nursing Studio, give us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one, at gmail.com. The things that are offered, we have review book options, ebook and paperback, both linked in the bio of this channel. We also have a self-paced course that is also linked in the bio of this channel as well. This is videos broken down by each system for our FNP as well as adult Gero reviewers, and it prepares you for AANP and ANCC. You can stop the subscription at any time, but you're able to watch these videos over and over, broken down by each system with mini quizzes on each. It also has a non-clinical section included as well. We have our 5-week course. The next one starts June the 10th, and then one-on-one sessions that are customized to your needs. Most people do the custom package for structuring them from going from an unsuccessful attempt to a successful attempt. We gauge where you currently are, work with you based off of your weaknesses, work alongside with you throughout your studying, and then get you prepared to be successful. But it's always recommended to reach out either by phone or email so that we can gauge what you really need if you're trying to set up the one-on-one, because it is custom. So if you need any of those things, reach out to us. I look forward to working with you guys. But as always, make sure you meet me back here. Happy studying. Bye, y'all.